friends, colleagues, and ophthalmologists all over the globe. Welcome to our EGVRS Retina Tour. And for the 30 days of Ramadan, we will roam the world to meet the vitreoretinal stars, learning from them, sharing experiences, and we'll also get to know more about their personal life, their success stories, challenges they meet, and more about their countries. Our stop today will be in Asia. We shall land in Taiwan to meet Dr. Wai Chi Wu. And Professor Wai Chi Wu is currently the professor and chairman of ophthalmology at Chang'an Memorial Hospital, Taiwan. His main interest of research is in the field of pediatric retina, including retinopathy of prematurity, familial exudative vitreoretinopathy, Coats disease, abusive head injury, and pediatric retinal detachment. He has authored more than 150 papers and 5 book chapters, and we're so glad to have you with us today, Dr. Wai Chi Wu.
Hi, it's my great honor to attend EGVI's meeting and having a great interview. And I really feel honored and happy to attend this event.
We're so happy to have you as well. So let's go a few years back to your childhood and just let me know, have you always wanted to be a doctor?
Yeah, this is a tricky question. I think while I was young, the idea was not that clear. But as I get older, especially when I went to the high school, I saw my uncle practice as an ophthalmologist. I felt very inspired by his practice, and I saw all the amazing instrument and how he took care of his patient, and I really feel motivated. So I think this is a great profession for me because I'm not from a very wealthy family, so I have to be on my own. I have to count on myself. So being a doctor is a great idea that I could be independent in the future. Maybe I could have better support for my family. That's how I'm thinking at that time.
And have you got other family members who are doctors? Father, mother, brothers, sisters, or you're the only one who took this really tough profession?
My father is a veterinarian, so
Okay.
he took care of the animals.
Yes.
And my uncle and my grandfather, both of them were doctors, and but they are from my mother's side.
Okay.
So, 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 but yeah, it's not far away from me. The medical profession is around me since I was a little kid, and yeah, I feel that this is a very respectful profession, and but it's difficult to get there because like in Taiwan, only the best student can enter the medical school. It ranked #1 in Taiwan. Yes.
Same in Egypt as well.
Oh.
You have to have very good grades in high school.
Yeah, yeah. In Taiwan, we have the tradition because we are kind of influenced by the Japanese culture. So they have very high respect for doctor in the society. So I think this is a dream job for a lot of kids here.
So tell us about your family.
I have a wife and a kid, and I'm I'm very happy that my boy, he was the first year the freshman of the university, and he also got into the medical school, the top medical school here in Taiwan. And
Congratulations.
thank you so much. He's really lucky, but it's highly competitive here. You know that in Asian, the examination is tough. Most of the kids has to attend a lot of, cram school, and after the school they go to the cram school for additional study, and they usually go home very late.
So
And
how many hours like do they have to attend? Do they?
usually they study, I think, from 7 a.m. until 11 a.m. PM, 11 p.m.
Oh, so
Yeah,
basically full day or
yeah,
like,
almost. And even on Sunday, they have these extracurricular classes.
this is
So
quite tough.
yeah,
Yeah.
it's quite tough. It's quite tough.
So, but I guess that he'll turn like father, like son, like a hard worker, and we're like waiting for a very eminent vitreoretinal surgeon, like coming in the future, hopefully.
No, I hope that he is not under, let's say, uh, I hope he is voluntary. He could enjoy his profession. He doesn't need to be ophthalmologist. That he could choose whatever he like.
Yeah, you want him to choose his own path.
Yes, yes, yes. I
Okay,
fully respect his choice.
sure. And tell us about your hobbies.
I think the the happiest sport I like is tennis.
Oh,
So
really? That's a very nice
yeah,
coincidence.
yeah, yeah.
Same
I
here.
try to. Oh, nice.
Yeah,
Then we should find time to play together.
yeah,
And
sure.
I try to play 3, 4 times a week. Even though it's short session, it's very good for me, and
Excellent.
I really enjoy it. And I also like swimming.
Nice.
Yes,
How's the weather like in Taiwan these days?
uh, Taiwan is like a subtropical climate, and nowadays the temperature is unstable in March. In February, it's colder. Um, so the temperature is around 15 to 25 degree. And but I think during this time of the year, the weather is lovely. It's not too hot, not too cold, and but in northern Taiwan you have more rain. In southern
Mhm.
Taiwan, it's dry.
Okay. So, and you're in the southern part?
Right now I'm working. I'm working in Taipei and Linkou.
Oh,
Uh, they were all located in the northern Taiwan.
okay.
Yes, yes.
Yeah, Taipei is the capital, correct?
Yeah, Taipei is the capital city, and Linkou is the city between Taipei and the Taoyuan International Airport. So it's
Okay,
somewhere between. So there are MRT interconnecting these two cities.
okay. And so tell us about the most famous dishes, food in your country, your beautiful country.
Oh, there are too many delicious food here, and I think uh, one of the most famous one is the hot pot.
Hmm.
Do you enjoy hot pot?
Huh?
You could put you could put you could put various ingredient, beef or pork, or
Okay.
vegetable, and they mix with the sour hot sauce.
Mm-hmm.
It's very nice. I do hope that Sunday you could come over here and enjoy these dishes. And also the chef ice is very famous. And you know what? The bubble tea is originated from Taiwan.
Okay. What is it? I'm not
Bubble
aware of.
tea, bubble tea is a drink
Okay.
with a bubble like a tapioca
Ah,
inside, very
yes,
chewy.
Rocky
Yeah,
Star. Yes,
yeah, yeah,
I
yeah,
know it.
yeah.
Yeah, like boba, it's called or
Yeah,
something.
yeah, yeah, yeah,
Yeah.
yeah.
Okay.
Some people call it boba tea.
Boba tea. Yes, yes.
Yeah, yeah,
Oh, what
yeah,
a
yeah.
coincidence, because my daughter just tried to make it homemade yesterday. And I was like asking, what is it? She said it's an Asian like drink.
I see.
Yes.
This is
And
the original place.
I did not know. Well, good to know. And so
Taiwanese people like to eat, so we have lots of creation.
good, nice. And you told me you've been to Egypt before.
Yes, in 2017, I was very honored to be invited by Professor Montada, and I gave a lecture over there, and I really enjoy your meeting. Yes,
We'd like to have you again. Okay, in our upcoming
hope
meeting.
so.
Our next
Yeah,
meeting is in June. We'd love to see you.
yeah. I think once the quarantine regulation is lifted, I will be very much loving going over there to see our friends and have fun with you.
We are all looking forward about this whole quarantine thing, like ending.
Yeah,
And
yeah. Hopefully, the life will be back to normal soon.
hopefully, hopefully. And so my last question, and what are your favorite countries you travel to?
Ah, I think I enjoy visiting different countries. Um, I think each country have their own uniqueness. Like while I travel in Egypt, I enjoy your history very much. I visit the temple and the pyramid and all those amazing, stunning architect, and the rich history is astonishing. And I like the people. People are very friendly, and they are so easy to deal with. And I think they are very sincere, very passionate people. It's very similar to the people in Taiwan. So I think we immediately find ourselves to be good friends. And
To hear.
so yeah, I think I would definitely love to visit Egypt again. I haven't visited the Nile River yet.
Ah, you have to, and next time you just have to
Sure,
go
sure.
visit other cities rather than Cairo. Have to
Yeah,
go to
yeah.
see
I
other
would.
cities. We have just tell us when you want to come, and we'll let us do the program for you. Don't worry about
Yeah, I
anything.
would love to bring my family
Looking
all
forward,
together.
yes, that would be very
Yeah,
nice. Yeah,
yes,
we are all
yes.
more than welcome. So that was a very nice chat, and we are going to shift to the second part of our episode, having first
Great.
a short break, and then you are going to talk to us about artificial intelligence in ROP, correct?
Yes, yes. Yeah, it
So
will be my honor to do so. Thank you.
thank you so much. concept of humans versus machines in medicine has been controversial for several decades with the introduction of new technology. And as the practice of medicine is undergoing a paradigm shift with the expansion of artificial intelligence, Dr. Wai Chi Wu is going to give us a talk about artificial intelligence in the field of ROP. So, may you share your screen, please, Dr. Wai Chi Wu.
Ladies and gentlemen, good night. It's my great honor to be here to talk about artificial intelligence in RP. I'm very honored to be invited by the Egyptian Visual Retina Society. Let's share with you some of our experience in using AI in our daily practice. This machine is called Arthur. He is the robot working in our operating room. He has been in service for over 5 years. He is very reliable in delivering all the instruments between different rooms. And also in our clinic, we have a robot for patient education. So if a patient have any question, they could ask this robot for question. So right now, because of the fast development of the technology, you could also have a so-called defect. These two figures look similar, but one of them are real, one of them are not real. They are actually fake. So could you differentiate between them? So there are lots of applications in this field. So today I'm going to share three little study using the AI in RP field so that you could have better understanding how we could apply this technology in the RP care. First of all, I would like to talk about prediction of visual acuity and refractive errors of ROP patient by using AI technology. AI is prominent in ophthalmology, in diabetic retinopathy, glaucoma, age-related macular degeneration, have fast development in this field. In the past, AI has been applied in ROP. A computer-based imaging analysis like ROP tool, RISA, has been used for the ROP analysis. They were used to quantify the vessel tortuosity and dilatation. However, they were limited by semi-automatic mode. And until 2018, full automatic deep learning system, IROP-DL algorithm was developed by Michael Zhang's group. They also show very good sensitivity and specificity in identifying the plus disease. However, there are limited studies in prognostic prediction in ROP. So the goal of this study is to use AI to predict the vision or refractive error after ROP treatments. So from 2006 until 2017, we collect patients in our hospital. Here are the patient profile of this study. So you could see that their mean birth weight was 858 grams, gestation age 26 weeks. And most of the patients were stage 3, zone 2 with plus disease. And we divided our patient into two groups. Group 1 were the patient with IVI monotherapy. Group 2 were the patient with laser monotherapy or combine laser and IVI monotherapy. So we just input some of the basic data like their age, sex, gestation age, birth weight, stage, and information like zone plus IVI drug. Then with this prediction algorithm, we try to get their outcome. So we divided our patient data into training, validation, and testing groups. This is the algorithm we use, and this is the steps. Then this is the data we use to train the algorithm. So you could see that as the machine have more learning, their performance improve as well. This is a result of the prediction value and the actual value. So we could get to know the difference by using the root mean square error analysis. So this represents the deviation between the prediction and the actual value. So in here, we could get the average root mean square error, and we could normalize it to a value between 0 and 1. So the value here would be very similar to the concept of standard deviation. So here's the result. So you could see that in the prediction of best visual acuity, the deviation is around 0.2, roughly 20%. However, in the prediction of spherical equivalent, it's around 10%, 0.1. So you could see that the algorithm could predict spherical equivalent better than the visual acuity. So why do we observe such phenomenon? Because in myopia, in the RP patient, they were mainly influenced by several factors, such as corneal curvature, anterior chamber depth, and lens power. So if you could get the data of these characters, you could have very good prediction. So in other study, they could use a computer model and get the accuracy rate of 90%. However, they need to measure the patient's actual length and corneal radius. With the advance of the AI technology, right now, we don't need to measure those parameters. We just need to use the basic information. Then we could get a very good, reliable refractive error outcome. And why do we see that to accurately measure patients' visual acuity is more difficult? Because it is not only the problem of the eye, it's also related to the optic nerve and the brain. So there are lots of factors that could affect patients' visual acuity. So it's difficult to have a good prediction of patients' vision following treatments. So I think this study is the first to predict visual function of the treated ROP patient by using AI technology. But we need to further develop to correlate with the clinical data. For the second study, we use AI technology to predict the early stage of ROP. As we all know that ROP is a progressive disorder from no ROP to stage 1 RP with a demarcation line, stage 2 RP with a ridge, and stage 3 RP with a fibrovascular proliferation at the border of vascular and non-vascular retina. So it's important that we have proper RP screening so that we could reduce the risk of visual loss. Once you identify a high-risk patient, you could intervene timely. However, nowadays, there are high legal medical issues, and this process really have very low pay. So there are fewer manpower willing to perform RP screening nowadays. And also, not every hospital has the well-trained specialist in this special field. And so we think maybe AI could help. So why do we focus on early stages of ROP? Because advanced ROP always started from these mild stages, and consecutive evaluation could reveal the information whether patient's condition is stable, worsening, or improving. So, for example, you would know that whether the patient is stable without progression, or they are really progression to a worse stage. So before we do that, we need to select a photo with good image, good quality. Photo with artifact need to be excluded like this. So this is a convolutional neural network using RedCam image. So similarly, we divide our data into training, validation, and testing. Then we were able to calculate their performance by calculating the accuracy, sensitivity, and specificity of the data. So this is a demographic data of our patients. And we also use the image adjustment. And these are the total image number we use in the study. So this is a result. So we could see that overall speaking, the AUC performance is very good in differentiating these early stages RP. Like, for example, the no RP versus RP AUC was 0.96. And for the rest of the comparison, the AUC was also about 0.9. So the performance of this model was really nice. You could get a very reliable result. So I think with this technology, we could use this information when we do a screening. We could pick up the high-risk patient who is progressing fast, and then we could send a doctor to have an on-site examination. For the rest of the patient, we don't need to be there. We could use the RedCam photo. We could use the telemedicine to do the job. And lastly, we could use artificial intelligence to do the automatic calculation of vessel width. When we evaluate the ROP severity, we use long stage and plus disease to evaluate. And then we use these criteria to compose the type 1 and type 2 ROP. When we look at the plus disease, we evaluate their vessel tortuosity and vessel dilatation. So the characteristic of the vessel is very important. And recently we published ICROP3, and this is an important paper. In this paper, we recognize that from no pros disease to pre-pros to pros disease is a spectrum of disease. So there is a progression from the least severe to the most severe. However, in the past, these characteristics were not quantitative. They are qualitative, they are not quantitative. So the present study aims to determine the vessel angle and width at the temporal side of the retina from the fundus image and related it to the severity of RP. We collect the data from our hospital, and here are the image we collected. First, we analyze the vessel angles. So we measure the arterial angle and the venous angle. And we use a software, MATLAB software, to measure the angle. So this is a typical photo of measuring the temporal artery angle and the temporal vein angle. We use a random transformation-based algorithm to determine the vessel width automatically. The random-based algorithm is a robust algorithm and can well detect the linear feature even in the presence of noise. So we calculate the vessel width near the optic disc up to 100 pixel width. The superior and inferior artery and vein vessel width at the temporal side of the retina were quantified using a random transform. We obtain temporal width and the temporal vein width by averaging the superior and the inferior artery width and vein separately. Here were the results. First, vessel angle. We found that the vessel angle were significantly different among patients with no RP, stage 1 RP, stage 2 RP, and stage 3 RP. We found that generally there was a trend. The more severe RP, the narrower the vessel angle was. So this is a multiple comparison result. So here are the typical feature of the patient with different RP severity. You could see as the RP progress, the narrower the angle the patient had. Then we look at the vessel width. Again, we found out that as the RP worsened, the vessel width were significantly wider in the patient with more severe ROP. Here are the multiple comparison results. So you could see that more severe ROP have a wider vessel width. Here are the example of these ROP patients. The data shown here are the pixel number we measure in these patients. So you could see there's a trend of as the RP get worsened, there were associated wider vessel width. So when we do the correlation analysis, we found that the arterial angle actually correlate very well with the venous angles. And also arterial width correlate well with a venous width. For the angle and the width, we found that arterial angle is reversely correlate with arterial width. So the main finding of this study was the severity of RP was related to the retinal vessel angle and the vessel width. There is a negative correlation between the severity of RP and the retinal vascular angle. And there is a positive correlation with the retinal vessel width, low only significant in stage 3. So the relationship between artery and the vein was positive, and the relationship of angle and the width was negative. So in conclusion, I think from these 3 small studies, we could know that AI application in ROP is possible. Its main function was mainly assist in prediction, diagnosis, and the image interpretation of the ROP photos. And we feel that there's a great potential in this field, and the future work is still needed. I would like to thank the help from our colleagues, and the 3 studies I mentioned were published in the Journal of the Frontier, BJO, and Electronics. Thanks very much for your attention.
Thank you so much for this very rich and impressive talk. I wish I had more time for discussion, but I just have one comment and one question. So we know that computer algorithms, Dr. Ricci, can process large amounts of data based on multiple parameters to determine a result or diagnosis. But do you think the humans, they apply clinical knowledge, prior experience, and the patient preference for management? So you agree to the concern of that many physicians are concerned that AI might replace them in the future? And do you think in how many years the AI will be actually implemented on a large scale in ROP screening practice, whether in developed or developing countries?
Yeah, I think this is a great question, and this is everybody's concern. I'm not so pessimistic. I feel that AI would not replace the work of the physician because we are the final person who take care of babies. So we are responsible for them. AI could be our assistant. They could help us to reduce the workload. They could do a job without needing to rest. So they could reduce the burden. They could, because screening, in terms of the screening, we screen 100 patients, maybe only 5 patients need intervention in the end. So the majority of the job actually is a waste of the surgeon's energy and time. And so I think those jobs could be shared by the AI. So right now, I think the development of AI technology is moving fast forward. We have the RayCam, we have the digital imaging system, so you could get the photo reliably. Then if you have, but I think the more difficult thing is the build up of the infrastructure. But if you have the infrastructure, there are lots of successful example of using AI for ROP screening, like Sandra. They use the telemedicine to replace the on-site visit, and they could get a very good outcome. They do not miss a single case needing intervention. So it's very likely that in the future, we could use AI to do screening, help us. But for the suspicion of patient, a physician has to visit and do the final determination. We are still in charge of the everything. So I think
Mm,
AI could be our good helping hand,
mm.
but we are the master.
Yes. I know we are all aware that the screening burden in low and middle income countries is often too high to be met with the available workforce. And AI assisted yes, screening may be a paradigm shifting strategy to improve the efficiency.
Yeah,
I want to
yeah.
thank you so much for this interesting talk and for this very nice session and very nice chat. And we hope to see you next time in person. And for the sake of time, we have to conclude this session for today. Thank you so much. And greetings from all the EGVRS family. And greeting to everyone in Taiwan. And thank you so much for all our audience. And see you tomorrow in a new session for EGVRS Retina around the world. Thank you so
My
much.
honor, my great honor. Thank you. Thank
Thank
you.
you. Thank you.